All right, 10 seconds. I'm gonna go off camera. We're live.
Welcome to the COVID313 Coalition for Families and Students. It is great to be back with you today on this beautiful sunny Thursday. And summer is definitely in full swing. And so we've got a really exciting program for you today. We're going to talk about COVID, and we're going to be talking about some men's health and opportunities for fathers. We also are going to be talking about the elections, because in the full swing of summer, we've got the primaries in August. So really exciting show for you today. I'm Christine Bell. I'm the Executive Director of Urban Neighborhood Initiatives and a real proud member of this coalition, going strong for almost 3 years, y'all. Long time. And we just can't get enough of each other and you all that come and view us every week. Per usual, we want to hear from you. So this is not a one-way conversation. Please put your comments and questions in the chat. We've got a number of moderators, chat moderators, that are really wanting to hear from you. And just to make sure that Brooke and Elizabeth, who is new, a new moderator with us today, and Colleen are on their toes, why don't you tell us about how you heard about the town hall today? And while you're doing that, we are going to give folks that are in need of interpretation services that information. So I'd love to welcome Cristina Guzman on to share how Spanish interpretation can be heard. Cristina?
Sí, buenas tardes. Si quieren interpretación en español, vayan al link que está en el chat en Facebook de Urban Neighborhood Initiatives en UNI y lo tienen en vivo. Gracias y que tengan un buen día. Bienvenidos a la charla de 313 COVID.
Thank you so much, Cristina. It's wonderful to have you with us again today. We're really lucky. And so normally we have ASL interpretation. And if they join us today, we will make sure that you know how to see that interpretation. But keep in mind, we will have closed captioning. So if you want to view the town hall later today or later in the week, you can, and there will be closed captioning. And now I'm going to pass it on to one of my amazing co-moderators, Miss Chimetta Lilly. So Chimetta, take it away.
And thank you, Miss Christine Bell. Christine, you got to be kidding. It is not quite 3 years. That's that oddity that we're all experiencing with COVID, right? It's like, what time is it really? And how much time has gone by? But we do know this. So we know that COVID has changed the landscape, it's changed our perception of what's going on. But we have learned, and particularly with this coalition, is that staying connected, even in these boxes, is really so important. And so to our audience, this is why we're here. We are here to help facilitate us staying connected, not only in COVID, but hopefully through it and moving forward. So my name is Chimetta Lilly, and I am blessed to serve as the CEO of the Detroit Parent Network and a super proud member of this coalition from Jump Street, if you will. I also want to do just a little bit of a quick shout out. So in this space today are 4 awesome young women. I want to brag on our University of Michigan future public health leaders who are in this spot and who have been watching the coalition and watching how all of us have been juggling and staying focused on children and families through COVID. So just giving them a shout out. Now, to our experts that are in the space with us and anybody who is going to speak, we want you to please remember to slow down enough for our translators. We want to make sure that they are hearing the important information that you're providing. Also be sure to turn off your camera when you're not speaking. We're also going to hope, as Christine mentioned, that we have ASL join us. And we also have a timekeeper. And so if Terry Whitfield is with us, you might get a little hit from him, or either Christine or I will gently try to let you know we need you to wrap it up. But either which way, we are so delighted to have you experts, and we're always super delighted to have all of you that join us during our live, but also who watch our programming that's being recorded on One Detroit. So with that, I'm going to kick it back to you, Christine, because as we mentioned, the reality is that our health and wellness has to stay foremost. So you know who we got to bring to help give us the latest information.
Yes. So with that, we would love for Miss Tanea to please turn on her camera and join us. Tanea Hackney is an outreach nurse with the Detroit Health Department, and we are so lucky to have her as a regular on the town hall, bringing us all of the good information that we need to know about the latest, and I don't want to say greatest of COVID, but the latest with COVID, because it has been a really difficult time for so many people, and it's been quite exhausting for all of us. And so, Miss Tanea, can you please I'm assuming you have a PowerPoint. Am I right about that?
You know, I always bring
I know you
things
do.
with me.
So I am going to let you take it away, and so go ahead.
Thank you, Miss Christine. Thank you, everyone. As always, it's always a pleasure to be here. I'll try to get through this much needed information from the City of Detroit Health Department. Let me share my screen and we'll get to it. Because first we need to talk about, where we are as far as the data. So when we look at the right side of the screen, Detroit, as of yesterday, since the pandemic has started, we've seen over 138,000 confirmed COVID cases. There's been over 3,500 confirmed deaths since the beginning. I kind of changed the slides just to give a visual of what we're looking at as far as the positivity rate. And as you can see, from May to July, there's fluctuation there. The fluctuation is around the time that we're meeting, around the time that we're gathering. We do see later in the summer months that the numbers are trickling down, but if you look at the numbers, they're coming right back up. Today is not reported, but if you look, just those numbers are because of the variances of concern that we have right now. Omicron is even more transmittable than Delta and then when we started. But the good thing is there's treatment. We'll talk about that. The first treatment, we definitely want to recommend for prevention is your COVID vaccine. We're looking at the City of Detroit Health keeps numbers on who's been vaccinated, and we're looking at the age groups. Our age groups that are really strong on getting vaccinated are our age groups from 65 to 74. We really need to encourage our youth to get vaccinated. And guess what? 6 months to 4 years old to 5 years old are now eligible through Pfizer and Moderna to get vaccinated. So if you want to get more information, if you want to get clarity, if you have questions, if you have hesitation, give us a call on the nurses line. There's a COVID line, 313-876-4444, and just have a conversation. You'll talk to a nurse one-on-one, and we'll be happy to answer those questions because it's vitally important. COVID isn't going anywhere. Like Jametta said, we're in year number 3. It's not going anywhere. This is something we're living with. Like Ms. Bell said, we're tired of it. Yes, but we still have to live. We still have to take a deep breath, know what the data is, know the information, but how do we keep living through this? The Detroit Health Department recommends, wearing the mask. I know you don't want to hear it. I don't either. But this is where we are. If you're going into crowded spaces, I definitely recommend wearing a mask. The Detroit Health Department recommends wearing a mask because with the variances that we have right now, you can get reinfected. The vaccine producers are looking to readjust the vaccines because unfortunately, these variances are outsmarting. They're just getting stronger and stronger because as I showed you the data earlier, we're just not protected with vaccines. If you can't get vaccinated, wear a mask, get tested. You might have a nasal drainage, a headache, something so nausea. If you're not sure, get a test. You can order home tests at covid.gov. I think it's covidtest.gov. There's 3 rounds that you can order. I definitely highly recommend have a home test. If you have any questions at all, call us 313-876-4444. If you're not sure if you should be vaccinated with a booster, give us a call. If you're positive, what to do? Call your primary care physician or call us because there's treatment for that as well. If you need to get tested, you can call 313-230-0505 to make an appointment. Treatment is available right here in the city of Detroit. Just call us, please, 313-230-0505. I will, I just want to reiterate and let the citizens and residents of Detroit know that in the city, you have vaccines available, you have testing available, everything's here for you. Take advantage of it. There's no price. Anything that comes from the City of Detroit Health Department, there's no price. We even have information as far as quarantining and isolating. Guess what? We have information about your children getting vaccinated. And we have pop-up clinics. The next one is July the 23rd, Quail Recreation Center. And this doesn't just cover COVID, it covers all of your vaccines. So if you don't want to make an appointment for vaccines for your doctor's office, you have July 23rd, August 6th, August 13th, August 20th, August 27th, before going back to school. Guess what? There's free prizes. There's Target gift cards, all kinds of gift cards, bicycles, tablets being given away. You don't have to make an appointment. Just come, lead testing. But I do highly recommend give us a call. I'm going to stop sharing my screen. And if you have any other questions, please give us a call at the Detroit Health Department at 313-876-4444.
So, thank you so much. And thank you for repeating the health department's number multiple times so that people know that if you have questions about the vaccine, if you have questions about where to go get tested, call the health department and they'll be able to point you in the right direction. We do have a question from the audience, which is why are some medical institutions not offering vaccines for children under 5? I tried contacting my child's pediatrician at Beaumont and they say they're not offering it yet.
That I can't answer. It's totally up to the primary care facility or provider and whatever their requirements are or just not wanting to do it. But we do have them available at the Detroit Health Department at 100 Mack Avenue and the Northwest Activity Center. So if you need assistance and you have questions about those vaccines for your children, give us a call. We'll answer those questions. But unfortunately, the Michigan Department of Health and Human Services might be able to answer that particular question, or that doctor's office. They just may not want to.
So in summary of what you said, the Detroit Health Department is offering the vaccines for young children under the age of 5, and they can get those at the Northwest Activity Center and
100 Mack Avenue.
And 100 Mack Avenue. So the Northwest Activity Center and 100 Mack Avenue. And my co-moderator, Ms. Jametta Lilly, has a question, and then I have another question. So Jametta, go ahead. And
Great,
then
thank you.
Yeah, go ahead.
Super always, Tanea, to have you on the program, sharing all the great information in the special way that you do it. You know, one of the things that we've learned that's pretty exciting, and the Racial Disparities Task Force has been really helping to promote this, is that we begin to make sure that schools can also be a resource. So there, in fact, are Detroit Health Department has been working with Detroit Public Schools Community District, such that all of their school-based health clinics can now not only offer immunizations, but also vaccines. So I wanted to say kudos to the department for working to make this happen. I do have a question though, and it's a question and a comment. So we know that there's been an uptick in everywhere else but Detroit statistically. So we know that really can't be true. It must be that so many of us are testing at home. But I'm concerned and wonder if you could comment. So the schools, obviously, we all know our children do better when they can be in school and in person. Have you been having any conversations with the school districts about what the threshold might be in terms of if we have X number of children who are continuing to show up with COVID? What are the implications of that? Parents need to be thinking about this, because if our kids are not getting vaccinated, that could in fact mean that there is we don't have a full return to in-person in school. Is that something that the health department is talking with DHD or others about?
Those are all relevant, and yes. I will say we're constantly talking with Detroit Public School Systems. Currently, Detroit Public School Systems is having an event right now. Matter of fact, one starts at 12, one starts at 2. Every Thursday, and vaccines will be given. This is Summer on the Blocks for Detroit Public Schools. Every Thursday, there's 2 at different locations. You can go on Detroit Public Schools and find those locations. But as far as going back to your question about talking about how do we roll out and getting the initiative, you know, having these conversations about getting the children vaccinated. Yes, that's why we're at Detroit Public School Systems, the Summer on the Blocks. We're communicating and involved with the Parent Academy. That initiative is directly to the parents, to talk to the parents, to hold sessions, answer questions about hesitancy, to, you know, just sit down and answer their questions and not make it seem like it's not forced.
Right.
We're only asking that, you know, if they can be vaccinated, or is it just because we're afraid? We all have anxiety, yes, but how do we deal with it? We have to have these conversations. So yes, behind the scenes, yes, Detroit Public Schools and DHD are having these conversations because we need our children to thrive. And they're going back to school in about a month. And they just got out. Because of not going in person.
And we know the impact when our children, as well as our youth, don't have the advantage of being with each other through this. So I just wanted to lift that up, and for our parents and our community partners to be really emphasizing this, because we could have a very different fall than what we want if we're not focused and diligent on engaging our parents and helping them answer their questions so that children can become not only vaccinated, but be fully immunized with the other critical vaccines. So thank you, Tanea.
Thank
Christine.
you.
Thanks. So I just dropped into the chat, and I'm going to ask the moderators if they could put the Summer on the Block dates in the Facebook chat. And there's one today at Adult Ed West from 2 to 4, but all the dates are in the chat. I'm so glad that someone asked this question, Tanea, because we actually have experienced this at the organization, at my organization. We've had a number of staff that have tested positive in the last 30 days or so. And they're testing it. We're having them test and having the PCR test because we've also had a lot of false negatives. Yes. And so they're testing at the suggested time after the 5th day of exposure. And some of them have come back with a negative PCR test, and then, 7 days in or 8 days in, got a positive PCR test. So the question here is, has the Detroit Health Department heard anything about people taking longer to test positive? And any sort of information that you have around testing, because in addition to masks, like you said, and vaccines, testing is our other way of making sure that we can slow the spread or stop the spread completely. So anything that insight that you can provide to the potential of it taking longer to test positive?
That's a good question. It's very relevant. We have to remember that the tests are dependent on the test, the person, the individual, because everyone's different. When we say 5 days test after 5 days, that's a general statement. It depends on your immune system, how fast it travels through, how slow it travels through. We know that the PCR shows when it's in your system versus the antigen when it shows when you have symptoms. But honestly, those conversations are relevant, but nothing's 100%, unfortunately. And that's why we have multiple tests. But those are supposed to be the best tests that we're having, because everything's been, here, let's make this real, everything's still under study. This is, we're in our 3rd year.
Yeah, and like you said, the variants are, and this is, I do want to say this, and so I just want to confirm with you. It is normal for a virus to mutate essentially, and have different variants like the flu and colds and those kinds of things. So just wanted to, it's not abnormal that COVID is doing this. It's just that we're learning about COVID as it's happening, which is part of the frustration of all of us. So thank you so much for talking about COVID. I am now going to invite our new moderator, Rita, to join us. And she is going to talk with you about men's health. And I know that you brought a very special guest from the Detroit Health Department. And I will let Rita do the honors of introducing him as well. So thank you so much, Tanea. It's wonderful to have you.
Thank you, Ms. Bell.
Thank you, Christine, and thank you, Tanea. Thank you for bringing us a guest and a new member of our COVID313 family, Mr. Peter. So a little bit about, I'm a communications and marketing specialist at Chess Center, and for over a year, I've been a proud member of the planning committee for the coalition. And today I have the pleasure of hosting the conversation about men's health. We want to share resources and information to encourage the men and boys in our lives to take control of their health and to take proactive steps to live safe and healthy lifestyles. And again, welcome, Mr. Peter, to the COVID313 Town Hall for families and students. Can you tell us a little bit about yourself and what you do at the Detroit Health Department?
Certainly. Well, thanks very much for the invitation. It's a pleasure to be here.
Of course.
Again, my name is Peter Williams. I am the fatherhood community health worker here at the Detroit Health Department. I've been a community health worker for about 4 years. I am also a certified lactation counselor. Not a whole lot of men who are CLCs, even fewer who are not nurses. And I was asked to do that because we need someone to talk with men specifically about the importance of breastfeeding and how breastfeeding is important for both mom and baby, and the role that dads have in seeing to it that the baby gets what I like to call the most important food they'll have for the rest of their lives. Breast milk is just that, and it sets a great foundation for your baby. And as a dad, that's something that you want to see to it that they get. I have not always been in public health. I went to Wayne State University and studied public administration there, studying how to make government work effectively and efficiently. That is still something that we've yet to figure out, but we're working on it.
Yeah, and hats off for the lactation piece that you do, that support. I applaud you for that. Thank you.
Oh, thank you.
Thank you so much. Yeah. So again, welcome. And just as you obviously know, last month was Men's Health Month. And I actually read some information that men are less likely to see their healthcare provider about health issues than women. And I was also, as we know, the COVID-19 pandemic has made it harder for racial minority groups to get access to mental health and substance use treatment services. Can you tell us, what does the health department do to support men's health? What is the Detroit Health Department doing to support men's health?
We have a number of things that support men's health, and some of them are the same things that are supporting health in general. But in specific to men, there's a program called the Sister Friends, which is that peer support program that works with young women who are pregnant throughout through their pregnancy and throughout the first year of their baby's life to get them off to a good foundation start. Here at in the fatherhood program, we work with the partners of all of those women. If they're still involved in the baby and mom's life, we're there to work with them that same journey as to working with how that's going to go, what your new role as a dad is going to be if this is your first time, and what to do after the baby's born, what your involvement is going to be in breastfeeding, in changing the baby, and all of those things that are involved in that. All that has to do with your emotional well-being. Babies are stressful, and they're not going to not be that. And so having someone to sound things off of, having some information that helps with the stress around that, so that you can enjoy being a dad and it's not as stressful an experience. In the lead department, we have a lead parents advocacy group that gives, and particularly with dads, because when there's a threat to our children, men want a target. We want something to do, and the lead parents advocacy group gives you just that. We through that program advocate for our children and advocate for children in general about lead poisoning and how to protect them from that. What to do once a child is lead poisoned, having information so that you can know how to bring their lead level back into order. And then there's the Children's Special Health Care Program, which works with parents whose children have special health care needs, whether those be physical or in their development. We work with those parents and keeping them informed and helping them with the stress of dealing with a child with special healthcare needs can be, because it can be quite stressful. It can leave parents with a lot of helpless feeling, but there is a way to overcome that, and we at DHD are looking to do that. Specific to fatherhood, we have again with getting young dads involved. We teach safe sleep classes for young fathers, so that they're learning how to put a baby down in the proper way, so that the babies are sleeping alone on their back in a crib and in a smoke-free environment. We want to make sure that babies are as safe as possible. Understanding how to do that, again, takes a lot of stress off of you if you know that you're putting your baby to sleep in the safest manner possible. Again, teaching breastfeeding. Your partner is going to breastfeed. She's going to be willing to initiate breastfeeding and be willing to do it for longer with your involvement as the male partner, as the dad. And you being involved in that gives you something to do to provide for your baby. That combats some of that helplessness that we feel with, hey, what am I supposed to do? Well, here's something you can do. And we'll talk about that. And I do a PowerPoint presentation called Breastfeeding Basics for Brothers. And it's all about how to get you involved as a dad and what you can do, what strengths you're bringing to the table when there's a new baby, and how you can access those.
That's amazing, amazing work that you're doing. And those are great resources. And being a mother of two, I understand all of the frustrations with parenting. You're expecting something to go one way, and it's just not. And like you mentioned, it's like, what do you do when things are not going the way you plan? And now with these resources that you're sharing and with the education, you can somehow you can learn how to navigate those stressful parenting situations. So how can the community access those resources or those classes?
Any resources that we have, we can get to you if you call 961-BABY. That's 961-2229. But 961-BABY is a lot easier to remember. Operators there can get you in touch with me or with any other program that you're interested in that can assist you with being a parent or with health in general, because we are concerned about men's health. Men, as you said, we do tend to ignore our health. It's something that we do. Some of our upbringing, men have been taught for a long time that we're supposed to suck it up. If you're having some difficulty, hey, you know what? Pull yourself up by your bootstraps, suck that up, get back to work, get to doing what you got to do for your family. And that isn't always the healthiest thing for us to do. So we have addressed that in a few men's health events that we had here with the Fathers Forward program. We haven't had one in a couple of years owing to COVID. We haven't been able to do that. But prior to that, we had a couple of really, really great outreach activities, which I'm hoping that we're going to be able to get going sooner rather than later. We did movies with Dad at movie theater, local theater here in town. And we had the whole theater. We went to go see a movie, and we had a health fair in the lobby as you were coming in before the movie started. And we, at that event, found 5 dads who were there with their kids who had blood pressure that was in the danger zone, and they didn't know it.
Wow.
Probably because, those little headaches they've been having all the time, let me just ignore that. I'll take some Tylenol, but I got this to do. I've got that to do. And those headaches were being caused by the fact that their blood pressure was dangerously high. And we were able to screen them for that and get them treated so that they're there for their kids. That's one of the ways we've addressed men's health. We also had a health fair connected to the Daddy and Me 3-on-3 basketball tournament that we did again a couple of years ago, and we found dads that were in need of a number of healthcare services at that event, including some that were looking for some mental health care services. We have a behavioral health division here at the Detroit Health Department, and we can connect you with behavioral health services as well.
Is there a number for the behavioral health that you can share now, or if you can share it with us later, we'll share
Again,
with the audience.
I would direct you to 961 baby. I don't have the
916
behavioral health
baby.
number right in front of me, but we can get you anywhere from that number.
Okay, great. 916 baby. Is that correct?
961.
961 baby.
Correct.
Okay, perfect. We'll write that down. Peter, again, thank you so much. I think that all of our hosts here and the team here is going to agree that we would love to have you back if you're available. We'll, next time that we have a conversation, we'll ask if you're available. And thank you again for the information. Is there any last thoughts, any information that you wanna let our audience know before we hand it over?
Last thing I would say is don't ignore any warning sign that your body is giving you. If you're getting headaches, if you've got frequently are having shortness of breath or chest pains, don't ignore that. Don't suck that up. Go seek medical attention. You got to see what's going on because you want to be there for your children as their dad. If you're having 3 days a week, more than that, over the course of 2 weeks where you're feeling down, you don't feel with it, get that addressed. We have resources for you that there's nothing to be ashamed of. Stresses happen to us like that all of the time. And you can join in a conversation with dads that we have once a month. This next one is coming up on the 26th. We have a forum where we talk about dads' issues with other dads. Last month, we spoke about how to talk to your kids about gun violence and school shootings. I was inspired to make that the topic when my son, who's going into the second grade, came up to me and said, "Hey, Daddy, did you hear about what happened in that town in Texas?" I'm like, whoa, wait a minute. I've been trying to keep you away from that news. How did you hear about this? And
yes.
I couldn't control every bit of that. He found out about it. He knew how many people, how many kids were killed. And I thought, well, wait a minute. I wasn't even ready to talk to him about that because I thought I was insulating him from it.
Yes.
So we've talked about that. We'll be talking about another men's health subject on the 26th. You can call or text me at 313-378-8110. Let me know if you're interested in getting in on that conversation on the 26th at 10 a.m. and we'll send you the Zoom link to that.
Perfect. Thank you so much. So thank you again. And I want to invite over Jameta. We're kicking it off to you and great information.
Oh, thank you. And call me again. I'll be back.
We'll call you.
Yeah, you guys have no idea. So in the background, all of us that are part of the coalition, we're all texting each other. Rita is marvelous. She should have been focusing as a moderator. Peter, you are great. Let's just make the whole program, Peter, and let's be talking about men's health.
Yes.
So thank you both. You both were awesome. Peter, kindly, if you would pop that upcoming conversation on the 26th back into the chat. We want to make sure that we get that.
Okay.
And those of us with Detroit Parent Network, we love the work that the health department does with Sister Friends, with Shirley Gray, all of you in your awesome work with the community. So we got to make sure that more parents know about it. And DPN, we're here to help in any way that we can make a connection. But as we talk about our health, the reality is that to address the issues of our health disparities, so often people talk about social determinants of health, but really it's the economics that so often drives our health. And if we're going to change our economics, that means we need to be thinking about who we vote for. Because voting is part of our power, and knowledge enables us to get the right people in these positions. So we are back in this stage where we have to consistently focus in on our voting rights and access to create the power that we need to keep our families safe and healthy. So I'm delighted to have in this segment and to welcome Sharon DeLant from Promote the Vote. Sharon, welcome. And we are looking forward to having you give us some updates about the upcoming August 2nd primary.
Well, hello, everyone. Thank you so much for having me today. And what a awesome segue that was. I loved seeing you tie all these issues together. Yes, my name is Sharon Delente. I am the senior advisor at Promote the Vote, and I'm going to try and give you some teasers today, get you excited if you're not already excited. I hope you all are. You seem like an engaged audience. And also just want to leave you in I'm going to touch on some, important reminders about the upcoming election, some of what's on the ballot, but also most importantly, try and leave you with a couple resources so you don't need to take notes. You know where to go if you have questions or you want to refresh your memory about something I've said here today. So let me see if I can share my screen. Here we go. I will try and start the slideshow. Here we go. Can I get a thumbs up from my fellow? Yes. Okay. All right. So exactly, you've got to know your voting rights, right? We have to make sure that we know them and we can answer questions. Again, I'm sure this is a really engaged audience, that you are the kinds of folks that your neighbors, your family, they come to you and ask you questions. And that's great. That's an amazing opportunity you have. Sometimes you may not know the answer, right? So this is a resource. MichiganVoting.org is a resource where you can get all kinds of questions answered about how to register, how to vote. What do I need to do to check my registration? How do I vote by absentee ballot? Lots of information on there in multiple languages, accessible for individuals with visual disabilities. So it's a really, really powerhouse site. And I want to encourage you to check that out if you have any questions after this. The second really powerful site I need to let you know about is michigan.gov/vote. Why? Because many of the things you want to do, you can do here on a government website right now. And I'm going to talk about some of those things step by step. What does that mean? You can register to vote online if you have a Michigan driver's license or a Michigan personal ID. You can check the status of your absentee ballot. Is it on the way? Where is it? You can find your polling location. You can find out where your clerk's office is if you want to go vote before Election Day. So these are two really, really powerful resources that I just want to share them right at the beginning, and I'll make sure to drop them in the chat as well. All right, so let's start going through our reminders, right? As I said, you can register to vote online. You can register to vote in so many ways now. You can do it by mail. You can do it when you get your driver's license. You can do it when you're at a public benefits agency. You can do it at your local clerk's office. You can do it. You just got to pick your way. And what we're coming up on is the end on Monday will be the last day that you can register in all of those different ways. But so between now and Monday, you have many, 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 many options. You just get to choose your own adventure. And after that point, though, you can still register, but you need to do it in person. So a few years ago in 2018, Promote the Vote and others were involved in a ballot initiative that made sure that you have a constitutional right. Well, actually, you all gave yourselves the right, the voters in Michigan. You have a constitutional right to register to vote at any time now. So up through Monday, you can do it all the different ways I mentioned. After Monday and up through 8 p.m. on Election Day, you need to go to your city or township clerk, the City of Detroit clerk's office, and go in person, register, and bring proof of residency. What is proof of residency? If you have a driver's license, if you have a personal ID with your address in the city, that'll suffice, but you don't have to have one of those. If you have your utility bill, your DTE bill, your trash bill, your, any sort of utility bill, phone, your cell phone, something connected to your Detroit address is all proof of residency. So absentee ballot applications are available. If you have not already requested your absentee ballot, do it now. You can do it online at that michigan.gov/vote that I mentioned earlier. Did you know, here's a hot take for everyone. Did you know that you can actually apply for your November ballot right now too? Right now, you can apply for your August primary ballot and your November ballot on your same application. As I said, you can do that online if you have a driver's license or a personal ID. If you don't, you can go to your city or township, or since we're mostly talking to Detroiters, I think here, you can go, but if you have others as well, go to your city or township clerk's office, you can get an application there. Many of you, millions of voters across the state who are on the permanent absentee list may have been mailed an application from your clerk. Any of these applications work, just jump on it, go ahead, fill it out, and get your absentee ballot on the way to you right away. Again, you are able to start beginning the process of voting, not just for this August primary, but for November as well. As I said earlier, you can track your absentee ballot at michigan.gov/vote, meaning you can see, has it been sent from my clerk? Or has it, I've sent it back to them, have they received it? You can track all that information online. So again, a really powerful source for you to keep fully abreast of what's happening with your ballot and your vote. Reminder, if you are on the permanent absentee list, you still have to request the ballot. Doesn't mean that it doesn't mean that you're going to get a ballot. You have to fill out that application. Some folks get confused about that. We definitely get a lot of questions about that. So we just want to remind folks right up front, under our current system, you have to fill out that application to get your ballot in the mail. And we want to, oh, go ahead.
Sharon, I want to just ask a quick question because I know we have questions at the end, but there's so much you're sharing. So back to the absentee ballots.
Yes.
You may be aware that the clerk sent out a recent ballot application.
Yes.
And those ballot applications we have seen have gone to senior citizens or people that have always traditionally received an absentee ballot. And in that document, it didn't provide the option of getting an absentee ballot for the primary and the main election, only November. How should people proceed? Because one, they've always received an absentee ballot, but now are getting something called an application, and the application doesn't reference the opportunity to get an absentee ballot for the primary.
Yeah, so that's a really great question. So under Michigan's system of voting by mail and absentee, you have to apply. So the clerk has always mailed out applications. And I was not aware, I had not heard that report, and I'm going to get a little bit later in the presentation to how to report any complaints or concerns. We do a lot of engagement with clerks. I was not aware that the applications that have gone out did not have the opportunity to check both boxes. So right. I'm going to make a note of that and reach out to them about fixing that problem. We can do some additional public education. So one option is you're going to get another application. Okay, so it's not as if you had to, when I said you have the opportunity to reply for your November and August right now, that is not your only opportunity. So let's make sure folks know that. You don't have to apply on a single form in order to get your November application. The other thing is that you could go to the michigan.gov website and you could print out an application from there. Alternatively, in a little bit, we're going to get to a hotline number that I'm going to give folks that they can call for any problem. And so, you know, if there are voters who can't pull one down offline, didn't get the one that they wanted from the clerk's office, we absolutely want to hear about that. And we can follow up, get a volunteer to, you know, drop one off at their house, you know, figure out how to troubleshoot to get that problem solved. Perhaps they want to go to a local satellite office and just do it in person, but it depends on the circumstances and what works for that person. That's a great question. Thank you so much for bringing that up.
Sure, we got about another 2 minutes, so okay. Happy to hear you, and then maybe we can take one question from the audience.
Yeah,
okay.
So I just want to remind folks to sign your absentee ballot. If you don't sign it, it can't be counted. So just a really, really important reminder. And we want to encourage folks who have their ballots to mail them back right away, but put them in the mail by July 19th. We want to give you plenty of time to get that back. If it doesn't get back in time, it is not counted. If you still have it, that's fine. Don't mail it though after the 19th. Drop it in a local drop box or at one of the satellite offices or one of the clerk's offices. Finally, I want to remind folks that we did have a redistricting cycle this year. So you just want to pay close attention. If you're going to go vote in person, you know, your information might have changed. Your polling location or precinct number might have changed. Many polling locations have remained the same in the city of Detroit. Again, if you go to the .gov website, you can look up your polling location. Also remind folks, it's unfortunately a piece of misinformation that individuals who are returning citizens, there's some confusion or misinformation. In the state of Michigan, individuals who are returning citizens can absolutely register and vote. So please make sure the word gets out. Again, it's a very unfortunate source of misinformation in our state. And finally, getting to the election day reminders, polls are open from 7 in the morning till 8 p.m. and at night. Again, you can register to vote if you are not registered or not registered at your current address at the city or township clerk's office. If you're in line by 8 p.m., you have to be allowed to vote. And then finally, here's this hotline number I talked about, 866 Our Vote, OURVOTE. There are experts on the other end of that line that can help you with anything right now. Just call with any kinds of questions or problems that you have.
That was a marvelous amount of really critical information. And we want to invite our audience that if you were not getting a chance to take notes, is to please go to One Detroit and watch the video of this discussion and grab this. And let's all love on each other and keep this knowledge as power going, so that if you are making sure that you're registered to vote and are going to vote, take your souls to the polls, that you're also letting your family and other relatives know. So we just want to remind the community of that. Christine, I'm going to kick it to you for both any last questions, and I know towards our wrap up. Thank you, by the way, Sharon, that was wonderful. Appreciate you.
Sharon, I have a quick question for you. So as we know, if you voted in primaries, sometimes there are things that are on the primary ballot that don't show up in November, that you're actually voting on, you know, different policies and things like that. Is there anything on this August ballot that voters should be aware of that will only show up on the August ballot than the November ballot?
I'm going to answer that question in a little bit of a different way that I think you meant it, but I think it's really important. So folks may know, right, that certain parts of the state folks in our state live, in different parts of the state, and some parts of the state tend to swing one way politically or the other. And what that means is that the likely outcome of who will be your state representative or your member to Congress is actually often determined in the primary, because let's say you live in a very strongly Democratic congressional district. Essentially, whoever wins the primary for the Democrats, will likely win in November. And so one of the things I would say is, for anybody in the city of Detroit, and I've been voting here for 2 decades, really, many of the races are determined in the primary level because of the sort of demographic population politics of folks in the city of Detroit. So this is where the action is, I guess, is another way of saying it. So make your choices now so that you get to make a choice in these elections.
So I love that, Sharon. The primary is incredibly important, is what I'm hearing from you. And it's important in those districts where the race is really determined during the primary, but also sometimes there are ballot initiatives that show up on the primary during the primary. So just wanted to really encourage everybody, vote twice, vote as many times as you can, as many times as you're able. So vote in the primary and in November. Thank you so much for being here. My job is to now wrap it up and give all sorts of fun announcements. And we've got quite a few today. So thank you so much, Sharon. So first, the Michigan Learning Channel. We can enjoy some interactive time together with our kids and join Michigan Learning Channel, Michigan's Learning Channel live on their Facebook page every Wednesday this summer from 4 to 5 p.m. for Weemie's Words Live. Join the lovable robot puppet Weemie, I hope I'm saying that right, and his friends as they discover more about the weekly theme. Weemie needs your help to write stories. Give Weemie your favorite words and ideas in the comments and watch as he incorporates them into stories and songs in real time. Your ideas may even be featured in future episodes of Weemie's Words on PBS. Well, that is super cool. That is really, really cool. I'm gonna have to check that out with my kids. And then Detroit Public Television community partners have two live and in-person festivals coming up. One is the Concert of Colors. It's the 30th annual World Music and Diversity Festival, and that is coming up fast. It's July 16th through the 24th. For more information about the artists performing and the venues, you can go to concertofcolors.com. And it is always a really, really wonderful show. So check it out. And then the Charles H. Wright Museum of African American History has its annual African World Festival at Hart Plaza. And that is this weekend. I actually just got an email from Heritage Works. They're going to be doing some really cool stuff with drumming circles and all sorts of really wonderful opportunities to engage yourself and then with young people. But the festival is July 15th through the 17th. For more information, you can go to theright.org. So that's the museum's website, theright.org. And then every bi-weekly Urban Neighborhood Initiatives hosts a Gleaners food distribution. And then we also host Wayne Health, and they provide various different tests, but they provide PCR tests for COVID, and then they also provide the vaccine. So that's tomorrow from 2 to 4 at 8300 Longworth. And then Wayne Health, so the food distribution is from 2 to 4, that's Gleaners. And then Wayne Health will be at 8300 Longworth from 1 to 5. So come out and see us. We'd love to see you. It has been wonderful being with you today. We are closing out right at 1. We hope you have a really wonderful weekend. Hopefully you'll get to check out the African Heritage Festival and, the African World Festival. And we'll see you in 2 weeks.